My name is Linda Seiter, and I'm the Executive Director of Caracole. And our mission is to positively change lives through prevention, housing, and care. We have been here for the past 32 years. We started out in 1987 as a small non-medical hospice taking care of people as they passed away from HIV. And since then, because of the new medications and the changes in science and prevention, we've really grown to be a full-service organization here in the community. Our services really fall into three buckets, but we're all about helping eliminate barriers for people living with HIV so that they can be as healthy as possible, and for those who are infected who may not know it, also to help them get tested, and then for those that are at risk, to provide support so they do not become infected with HIV. Harm reduction really has become the cornerstone of this agency, as the article suggests. And what that means for us is that, recognizing that people are going to engage in behaviors that are risky and in some cases harmful, and that basically telling people just to stop those behaviors, it hasn't worked. It's not going to work. And so we stand by people as they hopefully move towards health. So harm reduction really is about reducing harm for the individual, but also the community as a whole. And I think syringe exchange is a perfect example of that. Recognizing that some people are just not ready for treatment, and some people may never be ready for treatment. So the idea is reduce the harm to them by providing clean, available syringes so that they don't have to share needles, that they are less likely to contract HIV and other diseases. And with syringe exchanges, there's also the idea of engaging people and helping them think about healthier behaviors, like engaging in primary care, seeing a physician, and not necessarily saying you have to go for treatment. It's sort of inching them towards health. And I think that works for people. And we partner with Hamilton County Health to implement an on-site syringe exchange every Thursday night here in our office in Northside. So Hamilton County Health basically provided the technical assistance, the supplies. It's technically their program, but we staff it and we manage the syringe exchange in this location. And they have a syringe exchange access program that's mobile, so they have a van that goes all around the county providing services, and we are a fixed site. So we work with them to implement that. We really want the community to be involved in our work. I mean, clearly, we're a nonprofit, they can donate. That is always helpful, because while we have lots of grants that support what we do, it is never quite enough. The community can also encourage people that they love to get tested for HIV and support those who are positive, help us end the stigma with HIV, and to recognize, to educate and to realize that this is a disease like any other, that, the shame and guilt that some people carry because they're infected is so unnecessary and stops people from getting care. And also, we appreciate volunteers. We have a variety of activities that we use volunteers to help us with.